So Laura, well, you've been engaged with John Templeton Foundation and Religious Trust, and Godehard is also very familiar with these organizations. And together with Godehard, we applied for a grant which is on actually cross-teaching theologians in empirical psychology. And so this is what it is about, and this is why we have mostly theologians and theological philosophers here as attendants. Yes, we actually use the topic of growing from adversity to teach empirical psychology by also conducting research on this topic. And you are an absolute expert in this. And this is why Farhood reached out to get you here. And that's why we are very happy. So,
yeah, we are.
I suggest that we just start.
So you have some experience working with Templeton, if I understood that correctly?
Yes. So I've done a lot of work that's been Templeton funded, looking at this question of whether we can grow from adversity. And particularly my expertise has been, is that dependent on the types of psychological methods that we use? So are we more likely to see growth or measure growth more accurately if, we change our methods and change how we think about it? So that's, part of what I plan to talk about today.
Very good, perfect. It's a perfect fit.
So I have to admit, I am a little bit of a Zoom novice because we tend to use Teams. So I'm just trying to work out how I share my screen. Sorry, I know I should really be better at this, shouldn't I, after the whole COVID pandemic, but
all good.
It's in the center, at the bottom in the center.
It'd be green,
share screen.
A green button.
Oh, yes, perfect. So I can share a specific screen, right? So
yes, it's working.
So I don't know, Farhood, did you still want to say something about
Laura? You already discussed all the things,
sorry.
I mean, you will be you've been introduced already by your discussion with Godehard and Marcus, but it would be great if I could just say a little bit, about
please. Yeah.
So, today we are hosting Professor Laura Blackie, who is an assistant professor in psychology at the University of Nottingham. She received her PhD in social psychology in 2012 from the University of Essex in England. Her current research is primarily focused on two inquiries. The first one is post-traumatic growth and the extent to which individuals perceive positive changes following adversity. And the second is the extent to which researchers can effectively measure veridical post-traumatic growth over time. Her research has been supported through external research grants from John Templeton Foundation, European Association of Personality Psychology, and Templeton Religion Trust. She currently serves on the editorial boards of several respected journals in the field, such as Personality and Social Psychology Review, Journal of Personality and Social Psychology, and Social Psychological and Personality Science. Okay, I'd like to invite Professor Blackie to start with her talk.
Okay, well, thank you so much for hosting me today. And like you said, I've got quite a lot of experience talking to interdisciplinary audiences. So I really welcome your feedback and interested to hear what you have to think. So what I've done today is I've adapted a talk that I gave last month, which was a public talk, talking about what we know about post-traumatic growth and to what extent that is contingent on the types of measurement we use. So when talking with Marcus and Farhood, we talked about how this might actually be quite a nice way to introduce you to some of these topics without it being necessarily too methods or stats heavy. So I'm going to focus a lot more conceptually today and not necessarily get into the methods, but obviously the methods are a crucial part to how we define and study it. So especially because it's a Friday, and I'm sure you're probably all familiar with post-traumatic growth, hence you being here, but I always think it's quite nice to start with a quotation that illustrates what post-traumatic growth is. So this is a quotation taken from Hamilton Jordan's autobiography, and it's one that's used a lot in the post-traumatic growth literature. And he says, after my first cancer, even the smallest joys in life took on a special meaning. Watching a beautiful sunset, a hug from my child, a laugh with Dorothy, that feeling has not diminished with time. After my second and third cancers, the simple joys of life are everywhere and are boundless. I cherish my family and friends and contemplate the rest of my life, a life I certainly do not take for granted. So one of the reasons I wanted to start with that quotation is because this was really the starting point for post-traumatic growth. It came out of clinical researchers talking to patients and these perhaps unexpected experiences from adversity. None of them would want to relive adversity. You know, they wouldn't say that it was a pleasant experience, it was extremely distressing, but there were these kind of lessons or these recalibrations of their life that happened. And it all started from these qualitative reports. And what I want to demonstrate over the course of my talk is I think as we've tried to measure this and measure this robustly and look at changes over time, I think somewhere along the lines we might have moved away from some of the meaning-making processes that you actually see and the types of lessons that people identify when you ask them about their experiences of growth. So post-traumatic growth, as you probably are quite familiar, is defined in the psychological literature as a positive psychological change that happens through the struggle with highly challenging life circumstances. So it's normally measured in at least 5 domains. There are often more domains of post-traumatic growth, but the most commonly measured domains are people report feeling a greater appreciation of life, as we've seen from that quotation, improvements in their relationships, so feeling closer and spending more quality time with their loved ones, an enhanced feeling of personal strength. So individuals talk about how they didn't know that they would be able to cope with adversity as well as they have, and they feel that they'll be more resilient next time. Enhanced spirituality. So this doesn't have to be just about religion. It can also be kind of greater clarity and acceptance with existential issues. And that particularly seems to be the case in European samples compared to US samples. And finally, this recognition of new possibilities. So sometimes this can be, you know, this happened to me and I decided to rethink my life, change my career, change how I spent my time. So making these perhaps quite big changes to how you structure your life and how you spend your time. And I'm sure we're all aware that post-traumatic growth doesn't imply an absence of emotional distress. In fact, the meta-analyses that we have often show that they're very positively correlated. So the more post-traumatic growth people are reporting, the more distress they are experiencing about that adversity. So they're not distinct, and it's by no means upsiding or bright-siding what is a very difficult experience for people. So just to give you a couple of kind of contemporary examples, these are from my own life. Some of you might be familiar with post-traumatic growth is an extremely familiar phenomena that we know about in our own kind of cultures. We hear about it all the time. So you might be familiar with Kelly Clarkson's song Stronger, or the Dallas Buyers Club, which was a film, basically, I won't ruin it, where the main character went under quite a dramatic personal transformation, where he moved from being quite perhaps a selfish and self-focused individual into someone who was very kind of, in the end, compassionate and caring and other-orientated. So we can always think about these examples, which I think adds to the appeal that post-traumatic growth happens in life. And we can point to examples either in movies or songs, but also perhaps then projecting that onto, you know, people we know who have been through adversity. So quite traditionally, and I would say this is still the very dominant measure of post-traumatic growth and how it's measured in the literature, is through this post-traumatic growth inventory. And this typically asks people after an adversity has happened to them. And it can be a few months after, it can be up to 5 years after, it can be 10 years after. It really does vary in studies, but it's a retrospective account that asks people to rate how much they think they have changed as a result of that particular adversity or traumatic event. And it'll ask questions like, I have a greater sense of closeness with others. I established a new path for my life. I changed my priorities about what is important in life. And as you can see from this questionnaire, it's actually putting quite a high level of cognitive demand on individuals, because in order to answer this questionnaire, they have to think about who they were before, think about who they were now, do some sort of mental maths to work out the difference, and then also work out how much they attribute that difference to one specific, or two specific adverse events in their lives. So as you can imagine, it's quite a difficult task for us to think about, oh, well, I've changed, but how do I go about rating that change? And you can see that this is quite different to when you perhaps ask people in open conversation, how do you think the adversity's impacted on you? How do you think, you have made sense of it and made meaning from it? And again, this is rated from 0 to 5, with higher scores being individuals feel that they have changed and experienced much more post-traumatic growth than lower scores. So that's the post-traumatic growth inventory. It's one measure in time that asks people to reflect back and think about their life before that adverse event happened. Now, perhaps what's surprising about this was that a fairly recent meta-analysis in the last sort of 5 years looked at how many people reported moderate to high levels of post-traumatic growth. So not just experienced some post-traumatic growth, but these were individuals that were experiencing perhaps, reporting a 3 or, anywhere between a 3 to a 5 on most of those questions. So they were reporting quite high levels of post-traumatic growth. And perhaps surprisingly, 52% of people reported that they had experienced not only post-traumatic growth, but like we said, those high levels across 26 studies, which had a sample of over 10,000 people. And I should also point out that there was quite a diversity in the different circumstances that this questionnaire measured. So they had individuals who had experienced serious illnesses such as cancer, unexpected and very sudden bereavement, physical or sexual assault, or trauma exposure through their profession, so they were emergency or first responders. So these studies pulled from a lot of different types of adverse events, and what they concluded was that at least half of the sample, just over half of the sample, are reporting that they've experienced, a fair to high level of post-traumatic growth, which is perhaps quite surprising, potentially also quite an optimistic conclusion. However, and this is where a lot of my work has stemmed from, to what extent are individuals able to accurately report on how they have changed over time? So this question about people saying, well, actually, if I sit back and I think about how much I've changed and I report it on this questionnaire, how much does that actually reflect how they might have changed over time? Now, these studies are quite difficult to do because in order to be able to do this, you need baseline data about the person on each of these different levels of post-traumatic growth or domains of post-traumatic growth before the event happens, and then for periods after the event has happened, so that you can really track how much they might have changed in appreciation of life. And over the years, there have now been quite a number of these studies that most of them only collect, say, 2 waves of data. So most of them only collect, they have a large sample of people that they collect at wave 1, and then at wave 2, they collect and, try and get as much data from those people again, And in that time, there'll be a smaller subset of people that have experienced a particular event, a traumatic event happen to them. And then what these studies do is they look at how accurate people's perceptions are. So they give them the same standard post-traumatic growth inventory that I've just shown you on the previous slide at the second time point after the adversity has happened. But they've also given them at the first wave and again at the second wave, a questionnaire that asks them about those domains, but how they're doing right now within the last 2 weeks. So participants are rating how much they appreciate life, how close they feel to their, friends and family, within 2 weeks, at time 1 before anything's happened. And then at time point 2, they provide that rating again, the last 2 weeks, but they also provide a kind of more perception-based assessment where they think about how much they feel they've changed over time. And if people were able to report post-traumatic growth accurately on the post-traumatic inventory at one point in time, they were able to do that, then what we should see is strong positive correlations in these studies, because the more people are perceiving growth, the more that should actually be indicated in how much they've changed for the better over time. So if these measures are actually capturing and accurately capturing how people have changed across that, period of 8 weeks, then we should see not only a positive and significant correlation, but it should be of a strong magnitude, because they should be capturing the same things. But what you can see from all of these studies, if you look down the relationship column, is for most of them, there's no relationship at all. So how people report that they've changed when they sit back and think about the ways that, the person they were before and the person they are now, and make that sort of retrospective assessment themselves, that's completely unrelated to how they have experienced appreciation and changed in appreciation of life and quality of relationships over time. Now, Pat Fraser, in her original study, this was really a hallmark study for the literature, found a small positive correlation. But again, we would expect that correlation to not only be positive, but be much stronger if these two assessment types were doing the same thing. The other thing I think to point out about these two studies is most of these samples are based in the US. So a lot of this has been done within the US. There are a few more examples that I haven't included here, and some of them are in Europe. And most of them are looking at not a specific type of trauma or particular group, but they're kind of more, trauma checklist kind of opportunistic studies where an individual might indicate that a potentially traumatic event has happened from a large, checklist of events that they're given. So this is what we have so far. There's very little relationship between, how people think they've grown, their perceptions, and how they've actually changed over time, mostly in the US, mostly looking at a diverse range of traumas, and mostly looking at it over a very short time frame. So only looking at it, over 8 weeks or a period of 1 year. So I thought at this point I'd just stop and kind of go, well, so what? Why does that matter? Because I get asked this too by other psychologists who work in the health domain. So they're like, well, so people think they've changed and they haven't. Why is that, why is that a big deal? Why should we be, why should we be concerned with that? And here I've put up a screenshot of Pat Fraser's original study, which I just want to highlight 2 aspects, really. So when individuals were reporting how they thought they had changed, so when they were reporting it with the standard post-traumatic growth inventory, this was correlated with an increase in distress levels from time 1 to time 2. And with their kind of abilities to, with their reports that they were trying to cope with that event. Whereas when we look at when we actually created those, when she created those different scores and created a change score that really just captured how much they'd grown and whether that was a positive change or a negative change, you can see most of these that are related, but they're related the opposite way. So actually, showing change over time was associated with a decrease in distress. Whereas the process of actually trying to say, yep, no, I think my relationships are stronger. I think I think I'm stronger than I was before. That perception, that process of thinking about how you've changed and perceiving those changes was actually perhaps more indicative of a coping response when people were perhaps in a period of quite significant distress. So what I would say about this is that we should avoid invalidating people's lived experiences for many reasons. One is that this is looking at the average person in the sample, and not necessarily every individual will show this pattern. And additionally, but from a scientific point of view, it indicates that we need to know more about what the benefits are versus the harms of post-traumatic growth on recovery before we start designing any form of kind of interventions where we might be kind of encouraging people to think about how they might have experienced post-traumatic growth. So what we do know so far is that at least 52% of people report that they think they've changed for the better because of an adverse or difficult life event. When we look at how that relates to how they perhaps have changed over a period of time, spanning anywhere from 8 weeks to perhaps 1 year, there's very little to no relationship. So some studies have looked at, well, how much growth is there? If we just look at growth, not people's reports of growth, but if we just look at those different scores, or we look at how people have changed, that we as researchers calculate how much growth is there, which they've called genuine post-traumatic growth. And in Pat Frazier's original study, you can see that this really varies. So only 5% of her sample showed genuine post-traumatic growth in the domain of relationships, whereas 25% showed an increase in life satisfaction. So there was a bit of variability across the domains. Inferna looked at this in a midlife sample, so individuals in their sort of 40s and 50s in the USA, and he looked at this over a period of 2 years, every month, and he found that really only 11% had experienced genuine growth in at least one of the 5 dimensions that he measured. So, sorry, I'm just going to take a drink there. So what we know so far, people report that they've grown and changed for the better. That those levels are fairly high. This doesn't seem to relate to how they change over time. And when we look at how they change over time, it seems to indicate that genuine post-traumatic growth is actually quite rare or difficult. Now, most of my research has been focused on why that might be the case. So why do we perceive post-traumatic growth to be, to be there and to be higher than perhaps we are changing over time? And there have been lots of reasons that have been put forward in the literature for why this might be rare and for why people might report higher levels of what some individuals or some researchers have termed illusionary growth, where their perceptions are perhaps higher and not matching with their reality. And quite recently, Adriel Bowles did a review of the research, including my own, and proposed there's perhaps 5 reasons why individuals might perceive there to be greater growth than there is perhaps actually happening in it on average over time. And what he argued was that some of this might be influenced by a kind of emotional positivity bias, such that individuals might be trying to find positivity and meaning in an otherwise difficult situation. So a recent meta-analysis found that there was an association between individuals' perceptions of growth and different response biases in sort of 47 studies with 7,000 people, and that perceptions of post-traumatic growth were perhaps most strongly associated with downward social comparisons. So this is individuals who expected the adverse experience, to be doing worse from that, and we're actually thinking, well, actually, I'm doing better. That's unexpected. So perhaps projected growth on the basis of doing better than they had anticipated, or better than other people in that same situation. And then there were perhaps individual differences, such that some people just attend to positive information more so than others, and have a growth mindset where they think they are likely to change and develop over time. So those individuals were perhaps more likely to perceive and report post-traumatic growth. Additionally, as I've kind of alluded to with my perhaps rather dated cultural references of Kelly Clarkson earlier on, is that there is this inherent appeal to post-traumatic growth in that it's a comforting story, right? People can find meaning and grow and develop from the darkest of times. And this quotation is not actually about post-traumatic growth. It was written by a science journalist who was talking about why narratives should be used as a form of evidence when you're writing about science. And she writes that narratives are intrinsically persuasive because they describe a particular experience rather than general truths. Narratives have no need to justify the accuracy of their claims. The story itself demonstrates the claim. And even though this individual wasn't talking about post-traumatic growth, I thought that was such a compelling description of why people might take reports of post-traumatic growth that we hear from our loved ones, people we care about, stories we, hear or come across in our everyday lives, because they're not about proving whether this happens for most people most of the time. They're just individuals' experiences that really demonstrate and are compelling and alluring kind of stories that speak to us as individuals and story makers. And indeed, there are perhaps cultural expectations in certain places, like within the US, for example, where individuals prefer to hear these kind of redemptive, positive endings about traumatic stories. And they even prefer the narrators that use a redemptive and positive story compared to those that use a mixed or a neutral or negative ending. That hero narrative is one that we're familiar with, and it's appealing, and it has even been linked to kind of higher reports of meaning in life more recently. So I'm not going to go into this one in too much detail, but I just wanted to point to a couple of resources if you were interested in exploring the potential harms of a culture that might push or expect post-traumatic growth. There's a particular BBC podcast there where an individual talks about her experiences of cancer and how she really reacted to her friends and family trying to force her to tell them what the silver lining was. There was no silver lining. She just recovered and she wanted to leave it where it was. In addition, there was a blog post that I wrote on my Psychology Today blog post with a fellow philosopher colleague, actually, Ian Kidd at the University of Nottingham, where we talked about how telling this positive story might undermine our ability to kind of truthfully express ourselves and authentically connect with people. So, design and measurement issues. So this is where most of my research has been located in the last few years. So I'm just trying to move this, this video out of the way. So the problem here is, as I've mentioned, that when we ask people how they've changed over time, and we measure their perceptions of how they think they've changed over time, we're relying on their estimates that happen after the event. And there's been a lot of research recently that's shown that even if we're measuring just perceptions and we're not trying to make any conclusions about whether an individual has shown that growth in reality or not, the way we phrase the questions and the way we ask people matters, and it changes the frequency of how much post-traumatic growth is experienced. So recently, last year, I worked with Kate McLean and Jonathan Adler and Nick Westrate, who are really kind of prominent narrative psychologists in the literature. And what we wanted to look at was, well, if we move away from using these kind of questionnaire assessments, which ask people, you know, to what extent do you think your relationship has improved over time? Rate that from 0 to 5. And we just ask them in a narrative prompt, you know, tell us about an adverse event that you've experienced in your life that's fundamentally challenged you in some way. So we avoided using any wording that deliberately primed ideas of change. And what we found was, and this was consistent across 2 samples that we had, a university college sample in the US and a sample of online community members from the US as well, is here we've got 3 different types of measures. So we've got the standard post-traumatic growth inventory, a more updated version, but that's a retrospective measure where we ask people, to what extent have your relationships improved over time? 0, not at all, to 5, a great deal. We then gave them a revised stress-related growth scale, which Adriel Bowles has done some fantastic work on, that not only edits the way the questions are phrased. So instead of phrasing the questions with a positive kind of frame, it's my worldviews have changed. And then the response scale allows you to say, changed for the worst to varying degrees, not changed at all, so 0, or have changed for the better for varying degrees. That's why that response scale goes from -3 to 3. And we compared that to narrative methods where we didn't prompt anyone really about whether they changed in specific domains in life. And we didn't even prompt changes. We just said, write a narrative that explains to us an adverse experience that you have that was fundamentally challenging to you in some ways. We then had blind coders who weren't aware of the hypothesis of the study code this from 0, no growth at all the way up to 3, which was, you know, really kind of profound, reflective, integrative growth. And what I want us to focus on here is the frequency levels. So look at when you use the standard post-traumatic growth inventory, there's 82% of our sample were reporting some degree of post-traumatic growth. So we just calculated that as anything that wasn't 0. So it could be, you know, small growth all the way up to a lot of growth, but 82% of the sample experiencing growth. If you change the questionnaire and you allow them to report on negative change as well and report no change, and you make those questions more neutral, you can see that that drops down to 45%. And then our hypothesis wasn't supported. What we argued was that the use of narratives would drop that even further down, and that individuals would have like less of a demand bias or a prompt to talk about change. So it would perhaps be even more infrequent and perhaps more kind of salient to the individual if they did talk about it. Now, we didn't find that. We found very comparable rates of frequency of post-traumatic growth, at least in the college sample, across those revised questionnaires and the narrative methods. Slightly lower narrative methods here in the online sample. But what it shows you is that when we're talking about how prevalent it is, and we're asking people, to what extent did you grow? How we ask them really, really does matter. What we would also argue here, which I haven't put on the slide, is that even though narratives might be similar in terms of their numerical frequency of how much growth, it is also getting perhaps richer information that you wouldn't get from a questionnaire. So you're getting more context and understanding into the meaning-making processes that people have taken on their growth. And you're also getting not necessarily whether they've grown in all of these domains, but you're getting the most meaningful and salient growth that matters the most to them. So it is, there are advantages to that method, even though we didn't necessarily see changes in frequency. Now, another issue has been what qualifies as post-traumatic growth. And this is a question I get a lot, actually, when we talk about this interdisciplinary with philosophers or theologians. They also say, well, what is post-traumatic growth? If an individual changes temporarily for a few months and then goes back to normal, almost like a diet, and bounces back, is that, they've shown some growth for a bit. Is that post-traumatic growth? And how fleeting does a change have to be before we say, well, that's not change, that's not post-traumatic growth, that was just a temporary blip or response to adversity? Quite often people report negative changes. So it's not that they're all changing in positive ways. They might be, some relationships might be improving, other relationships are getting worse. So do we have to do some sort of formula that weighs the positives and the negatives and think about, some sort of equation to balance that? What if people say they've changed and their kind of outlook on life has changed, but it doesn't translate into their behavior or their personality? Should we count that as post-traumatic growth? So a while ago, and I know my colleague Aranda Jaiwikrame has already talked to you quite a while ago now, we thought, okay, well, let's think about this. What is post-traumatic growth? And we went back to the original definition, which, one of the original definitions, which talked about the individual not only surviving, but experiencing kind of qualitative changes to their personality, essentially. They didn't use the words personality, but they talked about changes that go beyond what was the previous status quo. They talk about how post-traumatic growth isn't a return to who you were before or a sort of clinical recovery. It's a sense of improvement in yourself that is really profound. So Aranda and I thought, all right, well, we do lots of this work in personality psychology. So we've cracked this now. Post-traumatic growth is just positive personality change, and we should be defining it within the theoretical models that we have and using the methods that we have, because then we can measure it robustly and we can develop kind of more kind of complex understandings of it using the theories that we already have. And this paper we published in 2014. We've since, with a series of colleagues, updated that in 2021, where we still argue that there is value to looking at it as positive personality change. But this is where I might break away from Aranda a little bit and show you some different results. So the last few years have been like, okay, well, if it's positive personality change, how do we measure that? How do we understand post-traumatic growth then? So this was a study that I did with Nathan Hudson, who's a personality psychologist that has done a lot of work looking at how people change their personality traits over time. And so this is people that are saying, I want to be more conscientious. I want to be more disciplined in my work. They might be saying, I want to be less neurotic. I want to worry less, be less upset by negative events. And he's shown that people can change their personality traits. They're small changes, but they're meaningful changes if they form these goals of, how they're going to change them. So this is what he calls volitional personality change. So it's not just saying, I want to change, but it's saying, I want to change. So every time I worry, I'm going to sit down and try and work out, 3 ways I can reframe the situation and why it's not, why it's not worthy of my worry. So change doesn't just happen. Change happens to the people who are sitting down and finding ways to change and thinking about how they're going to translate their wants and desires into reality. So I approached Nathan and I said, oh, look, I think post-traumatic growth might be a case of positive volitional personality change, which is, way too long as a tagline. But essentially the idea is that post-traumatic growth doesn't just happen to people. It's not a passive process after adversity. No, it's something that perhaps people sit down and go, I didn't like who I was before. I want to be a more agreeable person. I want to be more conscientious at work, or perhaps in this case, less conscientious at work and have space for other things. These are things that people sit down and reflect upon. So what we did was we measured people's changes in the 5 personality traits over time at over 16 weeks. And we also measured it, this was after in response to a recent adverse event that happened in the sort of 1 month prior to the study. And we were able to have a matched control group in this study. So that was not done a lot. So we were able to match people on age, gender, and at least age and gender, possibly ethnicity, such that we thought, well, if they change in response to a recent adversity, we're not going to know whether that's because they would have done that anyway or because of the adversity. So we selected people who hadn't had any adversity happen to them in the last 12 months. And we asked them, to what extent do you want to change your personality traits? And how will you do that? Form some goals to do that. And unfortunately, the results were not supportive of post-traumatic growth. Not supportive at all, in fact. So what we found, the only difference we found in all of the personality traits, 5 traits we looked at, was that agreeableness declined. So it got worse after a traumatic event. So how relatable and cooperative people felt with other people in their lives got worse. And this changed among the people who said they didn't want to change in this trait. So I'm like, okay, so I still think, there's merit and, it's an interesting idea, but even when we're looking at post-traumatic growth as positive personality change, we're not necessarily finding these kind of, straightforward responses. And then I just wanted to flag, so this was a special issue in a journal that Aranda and I published. And we solicited papers from lots of different groups that looked at post-traumatic growth in terms of personality change, a lot of them looking at personality traits. And across all these papers, the theme was that people really didn't change. People didn't show positive personality change. They didn't show post-traumatic growth on average. And they didn't show that in the time frames, at least, that we were measuring them, which was 1 to 2 years. So I thought what I would end with was kind of reflection on where we've started. We started with some studies that were perhaps flawed initially with their methods and found that people reported that they do, change, overwhelmingly positively after adversity, but that wasn't always kind of matching on average how people change over time. And then we've moved to studies that show, okay, we're going to use theories and methods from personality science to look at this more robustly. And again, we found that it's pretty rare. There's not a lot of personality growth that's happening over the course of 1 to 2 years. So it could be the reality is that most people, when they perceive post-traumatic growth, it is some sort of illusionary process, perhaps to help them cope with the difficulty of the event. That could be what's happening, like Adriel Bowles and others have argued. It could be that we've got self-selection biases and problems with our studies. So we're getting participants in who are having things happen to them and are still voluntarily signing up to participate in research studies. So it's possible that they might be the individuals who are perhaps doing all right at the start. So there's not much room or capacity for them to show growth. And the individuals that would are perhaps in struggling and in the difficult circumstances and are not, understandably signing up to participate in these studies. Could be that our time frame is too short. So we're only looking at this, 8 weeks, 1 year. Frankenfurter looked at 2 years. We're getting better with the 1 year to 2 year mark. But again, maybe adversity is a negative event primarily. So it might take quite a bit of meaning process and quite a bit of recalibration and structuring of your life before you're able to get to a point where you show that kind of post-traumatic growth. And it could be, so this is what I wanted to put out there, that we're just not measuring perhaps the right outcomes, and we're not measuring them perhaps the right outcomes at the right time. So these are my kind of more recent reflections. So another thing that I've done previously when I've looked at post-traumatic growth is I've measured it in the moment. So I've asked people about what we would call state measures of post-traumatic growth, where we send them like an alert that they answer on their phone up to 5 times a day. And in that, initial alert, they're asked, in the last 30 minutes, to what extent have you felt grateful to be alive? Or have you stayed calm? And these are good in the sense that they get round some of the issues with people trying to retrospectively remember, like, hang on, who was I this way before and am I better now? But they're also potentially quite strange measures that are disconnected from how people make sense of their experiences, right? Like people aren't necessarily feeling grateful to be alive, every 30 minutes, 5 times a day. While the principle holds that individuals who have grown should be doing this more in their daily lives, more on average than others, it also isn't necessarily perhaps the right way for us to be, or not the ideal way perhaps, is what I'm going to propose, to be measuring post-traumatic growth, even though it has methodological strengths compared to other studies. So where I'm coming to is starting to think about, well, is post-traumatic growth measurement more context specific and very much dependent on the personal meaning that the person's made? So maybe they haven't changed in all of these 5 different domains, like appreciation of life. Maybe not all of the quality of their relationships are changing. Maybe it's just that they're perhaps generally trying to be calmer and more patient with a particular family member who's frustrating. Maybe that's what they've taken away, is family's important. This person always, presses my buttons, and I'm just going to, in that moment, try to be more present, try to be less reactive, less defensive. And we wouldn't necessarily get at those types of changes in the measures that we currently have, because we're asking people, like, to what extent are your relationships better? To what extent the quality and the closeness and the intimacy of your relationship in the last 2 weeks? So they might still be too broad, where the changes are perhaps a little bit more local and specific to the person. So we might want to be thinking about moving towards measuring post-traumatic growth, not as changes to personality traits, which are perhaps generally quite fixed and stable over time, but in terms of a personality dimension such as narrative identity, which is really about how people reflect on their life experiences and make sense of their life experiences and pull all their life experiences into a coherent and consistent story. So a little while ago, Kate McLean and I published a paper that looked at whether the way in which people narrate their stories, whether that changes how they, their character traits like empathy, humility, and compassion. And we, again, didn't find that it changed those character traits. Those character traits were pretty stable over time. But I think perhaps where we want to be thinking about going next is moving towards trying to understand whether post-traumatic growth might manifest in these more kind of very specific meanings that people make of their experiences, and how that gets reflected into the stories that they tell over time, and how those stories might relate to things like well-being and eventually perhaps personality traits over time. So with that, I just wanted to say thank you so much for inviting me to present today. Yeah, it's been an honor, and I really appreciate you giving up your time on a Friday afternoon in particular. And if we have time, sorry, I was with my screen here, I was a bit kind of unaware at the time. I'm happy to take any questions if you have them. Thank you very much.
Thank you so much, Laura, and for your time on a Friday night, almost night. Yeah, are there any questions? Maybe Andrew wants to say something, I don't know, but it's muted. It looked like this at least, or just raise your hand. It may make it easier.
Thanks, Marcus. Let's go to Amber first. I think she was there before me.
Sorry for not having this seen. Here it is.
Yeah, so Laura, thank you for this. This was really, really interesting. I mean, I have lots of questions I could ask, but I guess one thing that I've just been curious about with a lot of the post-traumatic growth studies is, not only how like growth is understood and measured, but also how trauma is defined or understood. Because I mean, when I'm going through definitions of trauma and stuff, I mean, I know there was some controversy, like how the how the DSM-5 redefined PTSD. But even there, when they seem to give examples of trauma, but not really say like what trauma is. And then a lot of the definitions that I find say something like they include this condition that like trauma involves lasting adverse effects. So it's sort of built into the definition of trauma that it has adverse effects that last like over time. And I'm just wondering how that meshes then with folks studying, post-traumatic growth. Do they see these things as sort of not canceling out the badness of what happened, but like canceling out these lasting adverse effects? Or is the idea that the adverse effects are supposed to remain, and then there's also supposed to be growth on this other axis or in these other dimensions?
Yeah, so that's a great question. So what we mostly do in post-traumatic growth is measure potentially traumatic life events. And you'll see that written in papers quite carefully, potentially traumatic life events. And that is for the reasons that you have said, is that trauma in the DSM-5 criteria is not only just a subset of very specific events that threaten the lives or integrity of yourself or someone very close to you, but it's also defined by having a response, a negative response to it that a clinician can diagnose. And that could be PTSD, or it could be acute distress disorder, a sleep disorder, but it is about having a negative response. So most of these studies are getting in large samples of people because they have to look at, only a small minority of people experience events in a period of time, and they're just reporting that these events have happened on questionnaires. But not everyone will have a traumatic reaction to those, first of all. Additionally, there's also been, and I think more in this side, is that traumatic events, are adverse events, but I don't think it has to be just trauma that individuals show transformational growth from. So there are lots of events that are really disruptive to people's lives, like unemployment or, bereavement that's not perhaps sudden or unexpected, or divorce. And these wouldn't necessarily count under those traumatic checklists but people report them. When you put them out there, you ask them, any other stressful life event of this magnitude, and you've presented them with things like, you know, physical assault, sexual assault, and people, yeah, they talk about relationship breakups and various sort of other things. So we're either measuring potentially traumatic events without having the clinical data to know whether there's been a reaction, or have only measured that with a kind of post-traumatic, you know, a PTSD questionnaire, or you take the approach that doesn't necessarily have to be a traumatic event. It just has to be a significantly meaningful, perhaps adverse event to the individual that they would want to change and grow from it. Does that get at that?
I think so. I mean, I guess, because like, yeah, for me, like it wouldn't have to be, clearly it wouldn't have to be like the way that it gets defined in the DSM or something like that. But I wondered if there were, because if we define it by having adverse effects, like long-term adverse effects, I don't know. I guess, you know, it's a matter of like, is it just, are we just talking about events that people judge to be really negative in their lives, or is it something that, you know, we have to see some sort of adverse effect and then we see a, you know, a growth upswing or something like that. And I guess depending on the way that one would define what's going to be traumatic or potentially traumatic might change.
Yeah. So with the narrative,
result.
Oh, sorry. So with the narrative identity approach, I would say that it is much more about the meaning made. So they would argue it's not so much that the event is traumatic or not traumatic. It's just that this event has had significance on the person, and they've gone through a process where they are trying to make sense of it and find meaning in that event, so much so that they're restructuring their life moving forward. So it would be more on the subjective than the objective side, I would say.
Okay, I think Godahart, you want to ask something, right?
At the end, you, as a speculation, you said there might be still, we don't know exactly how to measure growth. And an area which I studied and talked to a lot of people is the growth after a near-death experience. This is a specialty of mine. And for example, there is about a 5-year period where people have the experience of slowly recovering, and they sometimes describe it as landing back in their former reality. So if they have a deep, very deep and transformative experience, and to be close to death is also a traumatic experience. It takes alone 5 years kind of to integrate it so much that it's no longer interfering with your daily activities, and gradually then all the changes develop from it. Maybe the time frames we need to measure growth from a really deep traumatic experience in lab settings, 8 weeks, 16 weeks. And so maybe that's just, it's not that there's no phenomenon there. It's just that it's really almost impractical for like cyclists. I know that one researcher on near-death experiences, Bruce Grayson, he's done a study recently asking people after 8 years and 20 years after the experience. And yeah, that's probably the time frame you need, which make it like for the average PhD students that's not an option, you know.
No, that would probably cause them a lot of distress, wouldn't we? So you have to stay in the program for like 20 years. But yeah, no, I agree with you. I think there's definitely something about the timeframes, and the work that we've done more recently has been focusing on trying to improve the rigor and the robustness of the methods. So we've had to collect, you know, data from scratch, you know, and often, you know, you're either your grants only fund a certain period of time, or you know, you pull together whatever funds you can across, you know, across your institutions, and it's very short timeframes. So I think that's true, but I also think it's true with experiences of like cancer and stuff as well, because I think sometimes we're thinking a sort of very simple way, like an event happened, yes, no. But actually, when you think about it, it's a series of events. When you get diagnosed with cancer, you know, like a series of treatments, a series of recoveries, you know, and then things change again, and, you know, your prognosis might get better and worse. And so I think also we haven't quite got the complexity there. And there are some colleagues doing amazing work looking at individual differences, like Michael Luhmann, at how people perceive events, like what it is about the characteristics of the events that change. But I also think that that's part of the issue. It's the time frame, but also we need to perhaps, we need to think about it a bit more of a journey that you're on with people, that evolves and changes over time, as you said, as they settle into recovery and settle into a new normal, but yet have the robust methods that we know enough about their past to know what a new normal is, and know that a new normal is in fact new for them.
Thank you. Okay.
So
Yeah, just a comment and quick question from my end. Thank you, Lori. A wonderful presentation, very clear. And I think just for all of us, it embodied, at least for me, it embodied the tension that our whole program here is trying to navigate in different ways. Because you started giving some interesting data about personality growth, and then there was a rupture in the presentation. It's like this moment of doubt that came in on this appearance and reality screen. It just made me think about the tension between sort of trust and doubt when it comes to those who are conducting measurements or these experiments. It's like, in some sense, we have to trust the reporting of individuals to whom we are approaching, but we have to bring with that a sense of doubt as well, that, well, perhaps the reality of what they're reporting is not the case. So I just think, and it's at that space, the tension between doubt and trust, in some sense, that we have to try to find a means of measuring. But that's precisely the difficulty. It's like, how do we do that? So that's what I'm struggling with when it comes to this, but I thought it was a great expression of that. My question is about whether you can say a bit more. You talked about the language of moments, series of moments. And I wonder if one way to think about growth is to think about it in a momentary fashion. What would it mean to think about moments of growth? Or thinking about growth being assemblage of moments together that show a sort of upward positive trend. And maybe we can connect that in some way to this narrative identity that you're talking about. I like that, but I don't know, maybe if you have something more to say about the possibility of momentary growth and how we can think about that.
Yeah, so first of all, thank you very much for that that comment. Yeah, I did, because this was partly a public talk, I did want to make sure I got that across. Like, I feel like we've made strides and improvements and our methods are good, but I also didn't want to be like, I don't know, I don't feel steadfast and confident to say post-traumatic growth isn't real. You know, I feel like, well, we also need to be, you know, we're making improvements and we're doing better, but I don't want to come out strong with that message when there's still more we could be doing. So momentary growth. So like I said, we looked at this before in terms of like what we would call state post-traumatic growth. So we've given people like a series of questionnaires over, a day. So we've said, like we give them 5 surveys over a day with very short questions, like in the last 30 minutes, how much have you appreciated life? But where I think this might need to go more is linking it with sort of narrative identity, where we look at people, not just how they're reframing the event, but how they're reframing their lives. So we just ask them about events that are happening, in their lives at certain points of time, a significant event that happened in the last month. And we do that over, multiple moments moving forward. And what we should hopefully see is that if the realizations that people are telling you, the meaning they made from those experiences are that they should, try and reframe how they feel about, this particular family member, or how they should, how they want to relate to work, or something in that sort of nature. We should see themes of that just spontaneously kind of reoccurring through narratives when we're not specifically asking them about the event again, when we're just asking them about they still have to be significant events, right? In the last month. I don't think you can just ask them, like, tell me about the time you did a chore or did something you had to do but didn't want to do. Like, you're probably not going to get it at them. But if you can ask people, like, tell me about something that had an impact on you, that was meaningful in some way, or tell me about specific events in your life, and you were able to do that over the course of time, what we should see is that if people are saying that they want to improve their relationships, that theme of communion and intimacy should be sort of perhaps more prevalent overall and spontaneously occurring and being kind of projected onto other instances in their life that isn't just about them retelling that specific adverse event. I think, does that make sense?
It does. Yeah, thank you. Yeah, I just wanted to hear a little bit more about that. So thanks.
I say something about, please?
Please.
Yeah. Well, as you already said, there are so many questions, facets, differentiations, in which facets you can grow, positive sides, negative sides, and change, and so on. I guess, well, it's difficult to judge if there is growth or if there's no growth. There's also the question of in which individual is growth and in others there's not growth, and to much percent if we actually can use certain numbers of how much growth. So the base rate of how many people actually grow from adversity might be very low. So maybe 20% of people grow. They may grow within 2 years, or as Godard says, maybe after 20 years. So it's extremely complex. But when, let's say, only 5% of people grow and grow like becoming Buddha or Jesus, yeah, it's fantastic. Great. And I would not exclude these people by just saying, well, there can be growth after adversity. It depends on so many factors, multipliers, like psychotherapy can be a multiplier for those who are not that self-reflective. So maybe, be an interesting approach. I would really like to go into this in the future, to really reduce the sample to those who might be especially interesting, for those who really report a major growth, and comparing them with controls, or
like the exemplars of growth.
Exactly.
I've been wondering about that too. Like, can we learn something about?
Absolutely, yeah. So that's where I'm very interested. And one more point is what we really try to differentiate in our research is assimilative growth, or assimilative changes as compared to accommodative changes. So true transformation, true change, not only coming back to baseline. And this is so hard to assess with self-reports, because often, as you know yourself, you also criticized in some way the self-reports. To which degree is a goal or a value integrated when we use self-determination theory, or is it introject? So is an introjection already growth? Is it only growth when you integrated the value, and when this even translates into behavior? Wow, it's so multifaceted, this question. And so this is why I doubt actually that research that just investigates changes in 5 big factors, for example, can really say something. We'll get meta-analysis that on average just do not find growth, but I think it doesn't say anything. And This is
Yeah.
why I also appreciate your research going more into depth and asking these critical questions, any critical questions that you
Yeah.
posed in the beginning.
Thank you. I mean, I feel like we've made progress methodologically, but
yeah,
like you said, it's such a complex program that, you
Yeah.
know, of study that we've made progress, but there's still so much to do.
Yeah.
And sometimes, you know, thinking about how you would actually feasibly do it all in a robust design is quite a task.
Mm.
So I won't be retiring anytime soon by the looks of it.
Yeah. Pass it on to the next century.
Yes. Yeah.
Anybody else, or Gina as
Yeah, I have a quick question.
Oh, yeah.
Yeah, I don't want to take up your time, but first of all, thank you very much for your talk. That was really interesting. You know, although you touched a little bit on it, you know, I wanted to delve more deeper into your study on short-term volitional personality trait change. So it seemed to me that you uncovered a random effect for trait agreeableness there. So it was like, I mean, first of all, you know, by random effect, I mean, you know, there were individual differences in growth regarding willing to cooperation, compassion, niceness, kindness, etc. Okay, but I was wondering if you guys just took a look at, you know, whether or not the participants who just declined in agreeableness were extremely high before or prior to the event or the negative event or not.
Yeah.
So first of all, I wanted to know whether you've done that or not.
So yeah, that's a really good question. I can't remember actually, like if they were particularly high and went down. What I do remember is that it was a kind of quirky sample, in the sense that the control group didn't necessarily show the patterns that had been shown before in Nathan's research. And we were doing this in a similar design, but we were doing it with UK participants. So I did wonder, like, you know, is there something about UK participants forming goals to change their personality traits, which is, I don't know, perhaps not as intuitive as in the US, with focus on self-development, because it was a slightly quirky sample, in that we didn't necessarily find, if I recall correctly, that goals predicted change in personality traits robustly in the control group either.
Okay. Okay, but in that case, my second question would be, you know, on a hunch, what would be your guess about any particular moderators, you know, that could tell apart people who want to decline in agreeableness or who want to grow? So do you have any idea on that?
Yeah, so we did also include a measure of event centrality as a moderator, and that's the extent to which an individual felt that the event was, you know, particularly impactful for them and their identity. So, you know, sometimes, like we said, these events happen, people don't have a response to them, but these ones where they felt like, no, this has now become an important part of my life story. And again, we didn't find kind of consistent moderating effects with those, because I would have thought one of the moderators we expected was to be forming goals, because like we said, I don't think this is passive. I think you have to think about how you want to change and how you go about achieving that change. But we also had like event centrality, and that wasn't a moderator either. So I don't know, it could just be a kind of a particularly quirky sample.
Okay.
But yeah, it was, I would have thought those would have been, conceptually, those were two big ones.
Yeah. Okay, thank you very much.
So yeah, thank you.
So yeah, I don't think that anyone has any question, right? So then, you know, thank you very much,
Thank you.
Laura, for your talk, and yeah, hope to see you soon again.
Yes, thank you very much. And thank you for inviting me and giving up a
Welcome.
Friday evening to hear about my research and be so kind of encouraging and gracious about it. I hope you all have
Have a
a lovely weekend.
good weekend, everyone.